Hello, I'm Dr. Craig Stern of Pharma Pharmaceutical Consultants. Following up on several of these sessions where we've talked about answers to questions that we've been asked. And by the way, we truly appreciate the questions. We look forward to it. The entire design of these series is about education. We don't have any commercial issues or anything to motivate or advertising, etc. What I want to talk about today is a question that was given, and that is, what's evidence-based medicine? I frequently joke with doctors, by the way, that Galileo was one of the primary motivators of experimental science and using evidence in science. That was in 1609, and medicine seems to have grasped the concept that we need to have evidence in the late 2000s. The real issue here is the following. How do we make decisions? If you take a look at it, the concept has always been, well, medicine has a body of information. There's been a group of information with regard to anatomy and pathology and physiology and pharmacology. But frequently it's been based on an art about how patients are viewed, how they're evaluated, etc. However, today, in 2013, there are thousands of diagnoses, there are thousands of drugs, and it's literally impossible in order to make decisions about this many choices without coming to some information requirement. And in that regard, what has happened is there is a body of expertise, a body of knowledge that has grown up around evaluating literature and identifying what the literature has to say and whether the literature is good studies, whether it's bad studies, whether it has been well controlled, and whether we have information that comes from it that can be used within the confines of treating patients and treating patients in multiple different settings. What evidence-based medicine does, therefore, is to look at literature and to ask the question, is the study evaluable? And let me give you a rationale why. There have been multiple studies that have been done to look at literature, whether it's in the major medical journals, major pharmacy journals, and ask the question, were those studies well done? Were they done according to scientific criteria? Sadly, over 50% of those studies were not, and it cannot be used, and the results cannot be used in order to treat patients or to give the patient a fair and impartial use of treatment. Since evidence-based medicine is not just used as a theoretical construct, but is used in pharmacy and therapeutics committees, it's used in medical decision-making, that body of knowledge looks at literature, whether it's gold standard studies like double-blind placebo-controlled trials or any other kind of trials, and says, were they done with appropriate scientific rigor? Were they done with the appropriate models? Was bias reviewed? Bias is in everything, but was it reviewed to the point where we can be assured of the fact that as much as could be done, it was controlled for? When all of that is done, we ask whether at the end that the study has enough veracity, enough information that we can use it in our decision making. That's really the basis of evidence-based medicine. We can go on and talk about this more, and I suppose we will. But I wish you a wonderful afternoon. This is Dr. Craig Stern of Pharma Pharmaceutical Consultants, wishing you a wonderful day and a wonderful week. And please continue to send us questions and comments. We love to have them, and if we can address them, we'll be happy to do so, whether you agree with us or not. Have a wonderful day.